Hello, everybody. The topic of this presentation is about the use of show lift in the treatment of patients with scoliosis. Why we use a show lift with the treatment of patient scoliosis? Normally, we use the show lift in two main cases. One case is if we identify a discrepancy of the leg's length in order to obtain a better balance of the pelvis. The second aim is if we see that with the show lift is possible an improvement of some specific outcome like the hand magnitude, the sagittal or coronal decompensation of the trunk. The aim of this study is to measure the trunk pattern on the coronal plane, only on the coronal plane, in response to the use of a show lift. In case of pre-existing coronal decompensation, we observed the reaction of the trunk when the show lift is respectively under the leg corresponding to decompensation or under the other. The methods. We evaluated 70 consecutive patients visited in our institute for scoliosis disease. With the patient in a standing position, we took a set of tests performed with a three-dimensional rasterography. The test was the use of a show lift, 5 millimeters, 10 millimeters, and 15 millimeters, placed alternatively under both the feet. We assessed the variation of two important elements. This is a mistake, it's not two important elements of our study. These are important elements in this town. We assessed the modification of the pelvic inclination, and we assessed the changement of the line that join C7 and the middle of the sacral spine. So the lateral decompensation of the spine. We divided the entire group of patients in three subgroups. In the first subgroup of patients, this patient showed a physiological inclination of the line between C7 and the center of the sacrum toward the right. The second subgroup, the patient showed a physiological inclination of the line between C7 and the center of the sacrum toward the left. And the little third subgroup, the patient showed no lateral inclination of the line between C7 and the center of the sacrum, always in standing position. With this number of patients, 20 patients with a lateral inclination of the trunk toward the right, 46 patients with a lateral inclination of the trunk toward the left, and 4 with no lateral inclination. Results. In our observation, the modification of the pelvic inclination was normal. I mean that with the show lift underfoot corresponding to low iliac side, the inclination of the pelvis tends to the normalization. And when the patient put the show lift under the foot corresponding to the higher iliac side, the inclination of the pelvis tends to increase considerably. This is normal. But we found that the use of show lift is not effective for the modification of C7, the line between C7 and the middle of the sacral. If the patient shows a physiological inclination of the spine toward the left, we expected a progressive reduction of this inclination if the patient used a show lift under the left foot, and a relative increasing if the patient used a show lift under the right foot. But this was the result, the real result. In this schema, you can see the group of the patient that is showing inclination of the spine toward the left, 46 patient, minus 10.59 is the mean of the inclination. As you can see, in all the situation with the show lift under the left foot, in 5 millimeters, with 10 millimeters, with 15 millimeters, the situation don't change more. It's the same if a patient put a show lift under the right foot, with 5, with 10, with 50 millimeters, the imbalance of the trunk is always the same, almost the same, don't change. We found the same situation if the patient had a physiological inclination of this line toward the right. You can see the group of 20 patients with the inclination of the trunk toward the right. You can see at 5 millimeters, 10 millimeters, and 50 millimeters with show lift under the right foot, the situation is almost the same. Same case with show lift under the left foot, 5, 10, and 50 millimeters, the situation don't change. So, in conclusion, in no situation, the use of show lift positioned under both feet saw a theoretical reduction or increasing of the inclination of C7 the sacrum, change completely the pattern of the lateral trunk inclination, measured in standing in normal position. So, the spine seems to have an individual anti-gravity pattern that cannot be modified with the use of show lift. The weak point of this study, the main weak point of this study, I think, is that I have not the possibility to reproduce the study with the patient after a sufficient time for the adaptation of the patient. I hope in the next period to do the same study with the patient in 2 different moments. For now, I thank you for your attention and go.